Morning.
Good morning.
What day is it? It's April 24th, Friday. 9. This is the Ways and Means Committee. Still,
GIF.
indeed. We are going to take a walkthrough of S-142. And then, we will vote on S-327. That's the plan. Here's Jen to do S-142. Ideally, we're also gonna vote on that. But we'll see how it goes.
Morning, 2
Morning.
days in a row in here.
Pleasure.
Deb Harvey, Office of Legislative Counsel. I will put the language up. And take a look. This is S-142, an act relating to a pathway to licensure for internationally trained physicians. You'll see it says here still and medical graduates, but actually the amendment coming out of House Healthcare takes out the references to medical graduates that have been in there since the bill was introduced, because there is already a pathway to licensure for internationally trained medical graduates to do a residency in the US or Canada and then become licensed, fully licensed here. So as it came out of House Healthcare, we're only looking at internationally trained physicians. It starts out with in section 1, there's a report due from the Department of Health in collaboration with the Board of Medical Practice due in January on a pathway to licensure for internationally trained physicians. So someone who's trained outside of the US and practiced outside the US and wants to, and is here and wants to be practicing medicine in Vermont. There was some testimony about a number of internationally trained physicians who are working here in maybe health-related professions, but are practicing well below their training because they're not able to easily get a license here without going through another residency program. So the report would look at other states' processes, how do other states do this, and what have the outcomes been? What external resources would be needed to evaluate the education experience and examinations of physicians trained outside the US, and are they available? A proposal in this report for licensing internationally trained physicians to practice medicine here, including potential qualifications and supervision requirements, proposed requirements for recency of practice. How recently did they need to have practiced in another country? And then a summary of any additional resources and statutory authority needed, and a plan and timeline for implementing the program. Anything else the department thinks is relevant. It directs the department to consult with other states and a number of other stakeholders and advocacy organizations in developing a report. Section 2, which was effective in January, and now that I say it, I think July of 2028. This would amend the statutes on qualifications for medical licensure in the Board of Medical Practice chapter to allow the board to issue a provisional license to practice at a participating healthcare facility, which gets defined, to an internationally trained physician who meets the requirements for provisional licensure that the board will establish by rule in the next section, and a full license to an internationally trained physician who successfully completes the pathway to licensure. Section 3, which would take effect in July of 2027, directs the Board of Medical Practice to adopt rules as needed to enable the licensure of internationally trained physicians. The rules must reflect the least restrictive form of regulation necessary to protect the public interest and include the qualifications needed for someone to get a provisional license to practice at a participating healthcare facility, the standards that those participating healthcare facilities would use to evaluate and assess the holder of a provisional license, and then what other additional qualifications would be needed for the individual to get a full license to practice here after successfully completing the provisional licensure period. Section 4 defines and creates the parameters for the participating healthcare facilities. So here we're talking about specifically a hospital, federally qualified health center, or community health center. And a participating healthcare facility means one of those facilities that meets the requirements of this section and is able to provide an assessment and evaluation program designed in accordance with board rules to evaluate the internationally trained physician with a provisional license. In order to be eligible to be a participating healthcare facility, the facility must agree to provide medical mentoring, evaluation, assessment, and support in navigating the U.S. healthcare system by fully licensed physicians employed by the facility to the provisionally licensed physician using the evaluation and assessment system, meeting the standards established by the rule, by the board by rule. Yep.
Slightly.
Care less about the details. Okay. Make sure that ensure that it's all fully licensed physicians, everything is happening in Vermont, and that they have medical malpractice insurance covering that provisionally licensed physician. And then we have the effective dates. So the report provision would take effect on passage. The rulemaking takes effect July 1st, 2027. Which means there are chances, opportunities to make changes during the next legislative session if necessary based on this report. And then actually starting with the pathway in July 2028. And then it would change the title of the bill to reflect that removal of the medical graduates.
Madam Chair, and again, this isn't probably our bailiwick, but again, I'm putting on my government operations hat. And I know years ago, we had looked at, international professionals that come here, and you don't see a provision in here in regards to background checks. And I know that was a concern back then when we were looking at that, a lot of these folks need to have a background check, coming from a different country, and how is that applied, and how's it mandated, and how's it happened? And I don't see it in here.
So there was significantly more detail in the bill that came out of the Senate about, not specifically, it didn't use the phrase background checks, although that is part of the Board of Medical Practice licensure requirements generally, I believe, is that there's some background check done, but it did talk about, it had a lot more detail in it. There was testimony in the House Healthcare Committee that the Department of Health and the Board of Medical Practice wanted to design the process themselves. And I think that's part of what is kind of baked into this report provision on the external resources needed to evaluate the education, experience, and examinations. So perhaps the experience and then the rulemaking provisions. So what the qualifications are and what qualifications are necessary to both for a provisional and but it does not get into the details.
So that'll come back through the rule process.
That will come back through the rulemaking.
Representative Brennan?
Do we have a fiscal note?
Well, we've got one more. Yes.
Tickets, it's not a portion of the internationally trained physicians are US citizens.
Are US citizens or are authorized to work in the US?
Are US citizens who trained internationally.
No, but this is not, so this is, as I mentioned, I think before you were in the room, it had originally related to internationally trained physicians and medical graduates. But there's already a process in law for medical graduates to do their residency in the US or Canada and become eligible for licensure here. So this is really looking at people who did their entire training outside the US. So in many cases, they're not US citizens, but they may be here with work authorizations.
Did the healthcare committee look at this bill?
Sorry?
The healthcare committee, did they?
Yes, this is their strike all amendment.
Okay, and the vote?
The vote was 11-0-0, I believe it's on your committee page.
Thanks, Jen.
Yes.
Appreciate it. Nolan, you're up. No. Thanks.
The record, Noel Langwell, Joint Fiscal Office. There's no fees in this bill.
You need a memo.
What? I'm
Is that
sorry.
the entire fiscal note?
Yes.
It's charming, Nolan.
I think I had one that was slightly shorter this year. Isn't that amazing? Worked out. But that was funny. I think the title is as long as the actual note. So again, there are no fees or anything in here like that. I suspect that it's here because a lot of times if these folks become certified, they will have to pay a fee to get certified, but there's no actual fee in this bill. So the only fiscal, actually, there's no fiscal impact. The only reason there is a fiscal note is because when it came out of the Senate, there was a fiscal note because there were some needs at the Board of Medical Practice for staffing and other things. So, but that this bill changed that, so it's just a study. And
Bill's never had a revenue impact.
I don't believe it did.
Cool. Great.
So anyway, the reason there's a fiscal notice because I want to be able to say there's no longer a fiscal impact.
Thanks. Any questions for Nolan? Okay. Yeah, Representative Maslin.
Just, I had a question during Jen's presentation about the particulars. Didn't review them by necessity. They're in the bill. And the bill itself explains valuation and can't remember the words, but anyway, the bill itself contains like answers my curiosity with the
Okay.
rest of what's here. So that's all good.
Great. Would that be a good segue for a motion to find S-142 favorable, Representative Maslin?
Madam Chair, I move that we find S-142 favorable as we received it.
Thank you. Is there any discussion? I appreciate that. Thank you, guys. Thank you. Any discussion? Seeing none, the clerk could please call the roll.
Sure. Representative Brannigan, yes. I'll vote yes. There's Representative Burkhart, Representative Higley,
Yes.
Representative Holcomb. Yes. Representative Kimball,
Yes.
Representative Maslin,
Yep.
Representative Odie is not here, Representative Page,
Yes.
Representative Wazazak,
Yeah.
Representative Canfield.
Yes.
Representative Kornheiser.
Yes.
You have voted the bill favorable 10-0-1.
Thank you. Representative Brannigan, can you cover this one?
Sure.
Thanks. Appreciate it.
Easy breezy.
It is indeed. Okay. Oh, okay. We're gonna take a brief moment while we pull up the amendment. Portia, can you, in the absence of an attorney,
Yeah.
think
Gonna leave it alone.
To the,
mhm.
to the economic.
To S-327, there was a couple tweaks that we asked Rick to make yesterday, and Rick is not able to be here today, so if we can take ourselves through them on our own, that's great, and if not, we can do it later. So, Portia, can you go to the annual program cap? So we talked about lowering those thresholds, but leaving the removal of the sunset in. That's what that does. That's the part about the sunset being removed. Yes, Representative Maslin.
Yeah, so I was unclear. We are taking the removal of the sunset out.
Nope, we're leaving the removal of the sunset there. The sunset is removed. There's no sunset
Anymore.
anymore.
I thought
It is
perhaps we were gonna.
Just one continuous beam of light onto the economy, Representative
That's
Maslin.
what committee decided or is gonna decide, then I'm okay with that. I would have preferred 10 years or something. I think it's a good idea to revisit these things periodically.
Representative Kimball, so we talked about, my memory of the conversation was, we've had a lot of different conversations this week, so my memory is not great this morning, to be honest with you, but my memory of the conversation was that we talked about what is a better way to have some sort of eyes on it other than a sunset, since we just sort of keep on pushing the sunset, but having the same conversations over and over again. And so Representative Kimball suggested that we lower the threshold to something that was much closer to the actual amount of money they're authorizing every year.
For that.
And them coming, if they need more, them coming in to ask for it would actually be a more fulsome conversation. And so we chose to do that instead.
That makes sense.
Okay. Cool. Let's go to third.
Assuming it's highlighted.
Indeed, look at here. Oh, yes, this is, sorry, this is to be very clear that this also applies to the education payment. They felt like it was not, it felt like it was probably true. But they wanted to clarify, this, attorneys wanted to make it explicitly clear that it was the education payment because it wasn't entirely explicit before. So, yeah,
Also, Madam Chair, up on item E, just
Uh-huh.
above that, Sorcia, is, I think, notice requirements. For that is a template, not requiring them to provide it free of charge, right?
Mhm.
Right. So it's a template model notice pursuant to this section.
But not mailing pieces of paper to every business. So it's not like one of those Department of Labor posters. It's more like a wash your hands situation.
Yeah. Slightly.
So even though it's not highlighted, again, that's the change to remove that free wording to, okay. Yep. Great.
That's the seventh, so.
So that provides an opportunity for the trade association members to
Figure it out.
do it.
Yeah, good.
So Charlie, what page are you on?
Whatever.
4 of
it is.
5.
4 of 5.
We're in the, I like to call it the penny section, but staff seem to keep on calling it the nickel section. Indeed,
Don't want to
and that's it.
nickel and
Thanks.
dime it.
I think we've really had enough jokes for a week.
Probably.
It was there.
You'll never change.
Oh,
Oh.
well.
Oh, okay. Does anyone else have any questions about the language? Anyone need anything else on this?
I do not. Thank you.
Okay, can I have a motion to find our amendment favorable?
Madam Chair, I would motion that we find our amendment draft 2.2 to S 327.
Thank you. Any discussion? Seeing none, if the clerk could please call the roll.
Sure. Representative Brannigan? Yes. I'll vote yes. Is Representative Burkhart, Representative Tigley,
Yes,
Representative Polka,
Yes.
Representative Kimball,
Yes.
Representative Maslin? Representative Odie is not here. Representative Page,
Yes.
Representative Wazazak,
Yes.
Representative Canfield,
Yes.
and Representative Kornheiser.
Yes,
We have voted the amendment favorable, 10-1.
thank you. Can you move the bill?
All right. Madam Chair, I would move that we then find are the S 327 as amended by our amendment favorable.
Thank you. Any discussion? Representative Kimball moved us 327 is favorable as amended. Seeing no discussion, the clerk, please call the roll.
Representative Brannigan? Yes. I'll vote yes. Is Representative Burkhart, Representative Tigley,
yes,
Representative Polka? Yes. Representative Kimball,
Yes.
Representative Maslin?
Yeah.
Representative Odie is not here. Representative Page,
Yes.
Representative Wazazak,
Yes.
Representative Canfield,
Yes.
and Representative Kornheiser.
Yes,
We have voted the bill favorable as amended to 10-0.
thank you. And Representative Kimball's been reported. Thanks, everyone. We're done for the morning. We're back here after the floor. We have 2 bills that I don't think will take too long, a charter change and a bill about libraries.